Hello and welcome to our first video for Pip and Girl. We are so excited to have you joining us, and if you're watching this, it actually means that you have brought our first book. So thank you even more. Thanks so much for getting on board. We're really excited about where this is going to go and the future of Pip and Girl. So thank you from the bottom of our hearts for jumping on board with this little thing that's going on. And so our first video today is going to go through the basics of female anatomy. We're going to take you from the inside out through the female reproductive system with our team Dr. Laura, which is going to be incredible to have her here on board. Now, everything we're talking about today matches up perfectly with what you would have already found in our book, and it also matches up with the downloadable worksheets as well. And so we hope that you've had a chance to download those. If not, hit pause for a minute and go download and print you off a set of those. So this video is useful for classroom teaching. So if you're a teacher looking for great resources for either your physical health PE program or biology classroom, you'll actually find that the content that we talk through matches up perfectly with the Australian curriculum objectives. But obviously, if you know the heart of Pip and Girl, then you know that we are all about empowering young girls and also empowering mums to be able to empower their daughters. And so this video is especially designed with mums and daughters in mind. And so we really hope that this will give you a great understanding of the female reproductive system and just highlight again how incredible and remarkable the body actually is, the female body especially. Not that males are not incredible too. Last thing worth mentioning is that in terms of where this video fits in introducing puberty to your daughters, it's actually a great place to start. So if you haven't even started any of these conversations yet, then this video is probably one of the best places to start. Just to start introducing your daughter or your girl or your girls to their body and helping them to get to know the ins and outs and all of the different parts of their body. We can't stress how important this is, and also how important it is for our girls to know the proper names for things. Knowing the proper names for the anatomical parts in their body does two things. First of all, it actually takes away any shame that could be associated with the female body. It helps them actually to feel confident in their body, to normalise all of their reproductive parts. And second thing, it's actually really important if your daughter needs to go and seek help in regards to her body. So for her to be able to explain exactly what's going on, for her to know the parts of her body, for her to know what's normal and maybe what's not quite normal for her is really, really important, and her being able to seek out help and advice if she's going to need it in the future. And so I want to encourage you can use this video to either empower yourself, mum, or you can actually grab a cuppa and some snacks and actually sit down with your daughter and watch this together. And feel free to pause and have chats with your daughter along the way. That's what this is designed for. The entire heart of Pip and Girl is all about relationships. And so sit back, enjoy, and I hope you get a lot out of watching our first video. We'll see you soon. Hi ladies, and welcome back. This is Laura, and I'm so stoked to have her here with us today. She is our team doctor here at Pip and Girl. So she is a qualified GP, and I'll let her introduce herself a little bit to you.
Yeah, sure. So I'm Laura. I'm a GP and a family doctor in the northern New South Wales, and I talk to women all day, every day about their amazing, always changing bodies.
Awesome. We just feel so blessed to have her on board here with us today. And so, as I mentioned before in the introduction, today what we're really going to just be talking through is the basics of female anatomy. It's a great place, as I mentioned before, to start conversations in regards to puberty, because really if you don't know where everything is, there's no point in starting to even talk about all the other changes that are going to be happening. So this video today does go nicely with our worksheets that we've produced. So we've got 5 worksheets along with a teaching guide as well in there for you. So our videos are designed to match up perfectly with these worksheets, as well as our books that are coming out as well. And so let's get into it. Basically what we're going to do is we're going to kind of start at the top and internal, and then kind of work our way down and to the external genitalia, to the outside lady bits, if you like. So let's get started with ovaries straight away. So girls, you have 2 ovaries. They are about the size of grapes, and I'm going to stand up for a moment just to show you. So Your ovaries would sit about there. Does that look about right, Laura?
Yeah.
So even if you just kind of dig your fingers in a little bit, just slightly inside of your hips, that's kind of whereabouts you'll find your ovaries situated in your body, and about the size of grapes. Your ovaries are incredible. They are responsible for releasing and producing eggs. You're actually born with all of the eggs that you will ever have in your body, which I found incredible when I first learnt that fact, that so even when you're a girl inside your mother's womb, you have all of your eggs already there. Is that correct?
Yeah.
Yeah, amazing. So about 2 million eggs, in fact. And then by the time you get to puberty, you have about 400,000 eggs in your body. So cool. So we are not as girls, we're not producing eggs all the time. We're not chickens. We're actually born with all the eggs we have for our life, which is really, really cool. So I think today, just before Laura gets into talking about our ovaries a little bit more, obviously when we're talking about the entire female reproduction system, it's for just that. It's for reproduction. It's for making babies and for giving birth. And so what we're doing today, though, there's of course this topic you could go and talk about for so long, but what we're going to do today is just give you really a brief overview. So we're not going to talk a lot about the menstruation cycle today. We're not going to talk a lot about pregnancy or giving birth or anything like that, and we won't go into a lot of hormone detail. All of that kind of stuff is going to come later. Today we really just want to set a good foundation for you to be able to know your body well and to start these conversations about puberty. So Laura, anything else you want to fill us in about the ovaries before we move on?
So good. So I guess I'll just reiterate that when you reach puberty, 2 really important processes begin to happen in your body. You begin to ovulate, which means that one of your ovaries will release an egg or an ovum each month, and you begin to menstruate, which means that you have your period. Now, these processes are directed by hormones in your body. They tell your ovaries when to release the egg, and then they tell your uterus when to shed its internal lining, which means you'll have your period. Now, your uterus is also known as your womb, and yes, that's that area up there. So once the egg is released, it travels down these thin, narrow tubes towards the uterus. These tubes are called the fallopian tubes. And the fallopian tubes are actually also where the sperm meet and fertilise the egg at the very beginning of a pregnancy.
Yeah, awesome. And so do you always release an egg from the same side? How does that work each month?
No, so generally it will alternate side to side.
Yeah, cool.
And at the very beginning, when you are going through puberty, you won't necessarily release an egg every single time.
Yep.
But as your period becomes more regular, then you generally are ovulating or releasing that egg.
Yeah, so cool. And what are these little funny bits here?
So these are called fimbriae, and they're little finger-like projections that help to catch the little egg as it's released from the ovary.
Very cool.
And help direct
kind of cute looking,
push it
really.
down.
Yeah, very cool. Awesome. So, as Laura just pointed out, ovaries here, okay, fallopian tubes, and now heading down to talking about our uterus or the womb. Let's go straight there. There's not much other information about the fallopian tubes. Hey, they're
that's about it.
Very cool.
Yeah,
all right, so talking about the uterus. Here we are. So let me grab this little model again. So as Laura just pointed out, uterus or your womb right here in the middle, it's actually the largest and I guess the most major organ in the female reproductive system. It's about the size of one closed fist, or about the size and the shape, my beautiful model here is going to hold up the pear, about the size and the shape of an upside down pear. Okay, and it's situated kind of just right in the middle of your body, in between kind of your 2 hips, but probably a little bit lower. Yeah. And so amazingly, this is how incredible the female body is. By the time that you are 40 weeks pregnant, your uterus has actually grown and stretched to about the size of a watermelon, incredibly. So all the way up under your ribs. And then once you've had your baby, through a whole bunch of different processes and breastfeeding even, your uterus actually shrinks back down to its original size, which is just incredible. The female body really is so amazing, hey? So amazing. So on the uterus here, you've got a really thin lining on the inside of your uterus called the endometrium. And basically every month, this is part of your cycle that we'll talk more about next time we talk to you, but it actually thickens during the month in preparation for that little cute little egg to come on down and nestle in nice and cozy and start growing. So at the end of every month, if an egg hasn't been fertilized, then that is actually what causes your menstrual blood and your menstrual bleeding, is that lining actually starting to shed. Amazingly, it's also a muscle, so it actually contracts, and obviously that's why you have contractions when you are in labour and about to have a baby, is that's actually helping to push the baby out. And you can have minor contractions as well when you have your period to actually help push all of that endometrium tissue and things like that out as well, which is why sometimes it can be quite uncomfortable when you have your period, or you can experience cramping and a little bit of pain as well.
Yeah. Okay, and that brings us down to the cervix, which is the narrower end, the bottom part of the uterus that connects it to the vagina or the vaginal canal. So your cervix, it's usually about 3 centimetres long, and really an important function of the cervix is to produce mucus or fluid. This changes throughout your menstrual cycle. So practically, this means that throughout the month you might experience some discharge or fluid in your underwear. Don't panic. This is normal.
And we will talk more about that next video.
Yeah, exactly. I'm just going to put that down.
Yeah, go for it.
So the function of the cervical fluid is actually to help with the fertilisation process. It helps transport the sperm up. Actually, I'll pick it up again. Up into the vagina, into the uterus, and into the fallopian tubes, where it can then meet the ovum or the egg and start the fertilisation process. Sometimes the cervical mucus actually gets thicker, and that's to prevent the sperm from coming up into the uterus and fallopian tubes.
Yeah, awesome. Yeah. So good. So following down then from the cervix, so as we move our way down the uterus, through the cervix, this down here, this canal here is called your vagina, okay? And I actually think it's crazy because I know growing up, my mum just taught me that whenever we were talking about the front of your front parts, mum just said to call it the vagina, which actually I guess is not correct anatomically, because your vagina is actually the canal inside leading up to your uterus, and so it's not, but we'll get to what it is actually called in a moment. So it's about 6 to 7.5 centimetres long along the front wall, but of course everyone is slightly different anatomically, and so that's just an average length. And it's not actually smooth inside either. So I don't know if you can kind of see on this video here, but it's actually got just little, they're called rigae, and so just little like rough ridges as it goes down the inside. And the external opening is actually kind of partially, or it can be fully covered by what is called the hymen as well, which Laura's going to fill us in a little bit more.
The hymen is a thin piece of tissue or mucosa, or a thin piece of skin basically covering the entrance of the vagina, and usually it only partially covers the opening. The purpose of the hymen, we actually don't really know what it's for, but they think that it might be to protect germs from getting into the vagina in little girls as they're developing.
Yeah, right.
Yeah, so, and it can actually stretch and tear from sports, so from horse riding or gymnastics, or through using tampons or menstrual cups.
Interesting.
So if it does tear, you might notice a little bit of bleeding or pain, and that's okay. That's normal. It's particularly common the first time you have sexual intercourse. So occasionally, very occasionally, the hymen completely covers the vaginal opening, which means that the first time a girl has her period, there's nowhere for the blood to go. In that situation, it's rare they might do an excision or a cut to make that opening so that the blood can come out. But like I said, that's not common.
Very rare case.
Yeah,
cool. So nothing really to be worried about.
Exactly.
Well, if you are worried, go and see a lovely doctor like Laura. Cool. So we are now going to move to chatting about the external genitalia. So that kind of brings us to the outside bits, the outside of your body. And I think probably the most important thing for girls to realise here, and I was just saying to Laura before we started filming actually, that I was so confused about this. When I was little, I was really worried that I wouldn't know where what was, and that maybe I would get, my bottom, my anus confused with where my pee was coming out of, and all kinds of things. And so I think this is a great model to start with here. So we've got the front of the body here. So you imagine this is coming down from your stomach down to the front of the body. And as we tilt it a little bit, the first hole that you have, so right to the forward, the frontist of your body, frontist, because that's a word, the frontist, there you go, I'm going to say it again, to the front of your body is the urethra. So this is the opening that your urine comes out of. So it's connected up to your urinary bladder where you store urine. Your urine comes down through your urethra, and that's where it comes out of your body. So that's right at the front. As you move down into the middle section, that is your vagina. And so this is right in the middle of your body, and it's quite a bit larger of an opening than your urethra. Do you think it's easy? Could you get confused between your urethra and your vagina?
Yeah, people do get confused, but
Okay.
but yeah, the openings are different, and the vaginal opening is a lot bigger.
Bigger.
Yeah.
Okay, awesome. And so then as you move even further around the back to your backside, you have your anus, is where your feces comes out of. Okay, so that's stored in your rectum, and then when that's nice and full, it's ready to come out of your anus. So those are your 3 different holes. I never saw this view until after I had a baby, to tell you the truth, and a midwife actually asked me to get a mirror and have a look and tell me if everything looked normal. And in all honesty, I was like, I've actually never looked before, so I actually wouldn't know if it's normal or not. So I don't know if that's something that you would maybe recommend to girls, is to have a little look, particularly when you get close to having your period and you're thinking about tampons or cervical cups or anything like that. Menstrual cups, to have a look to see where everything is located.
Absolutely, yeah. Particularly if you've got a diagram that you can kind of reference to as well, like the one that's in the book.
Yeah.
Which can really help figure out where everything is.
Yeah, awesome. So just above, I think we'll just kind of work through the external genitalia now. So just above the urethra is a tiny little bulge of skin called the clitoris, and so this is a highly sensitive part of your vulva, and it has heaps of nerve endings. And again, this probably becomes maybe more important when you are sexually active and going down that road, but at the moment there's probably not a whole lot of information that is needed to be passed on about that.
Yeah, sure. So if you are having a look with a mirror, you might notice that you've got these little lips at the opening of your vagina. So the innermost lips are often darker in colour, and they're called your labia minora, and then the outermost lips, or kind of flaps of skin, are called the labia majora. Now, these vary hugely among women, so don't panic. Some women have really small labia or lips, and some women have larger ones. In some women, one side will be bigger than the other. This is normal. So please don't panic and be worried that, your vulva or your external genitalia looks different to everyone else's. There's a huge range of what we consider normal. And if you do have worries that aren't settling down, please just talk to a female GP about it. If we're moving on, and that's important. So it's your labia as well as your mons pubis, which is actually this area up here over your pubic bone, where you'll first notice hair at the beginning of puberty. So, and same thing, the hair can vary from different people, and just because you've got brown hair on your head doesn't necessarily mean you'll have brown hair down below.
There you go, it's a surprise.
And then moving around here, which you can actually see nicely on this model, towards your bottom you'll find your anus, which we mentioned earlier, which is where your faeces or your poo comes out of. And again, there's a very tight sphincter there, so it's very different to the vaginal opening.
Awesome, so good. So ladies, that actually wraps up your remarkable body. I hope that you found that insightful. I hope that you'll be able to go back and look at the diagrams and watch this again if you need to make sure that you know your body inside out and really, really well. Before we go, I did want to just chat to Laura and just ask her just to pass on a few tips about how you can actually best care for your vulva, for your external genitalia, for your vagina. How can you best can care for your body?
Yeah, so that's a really good question. Luckily, the vagina is amazing in that it actually self-cleans. So the fluid that we talked about earlier, the cervical fluid, is the way that the vagina kind of self-cleans from the inside. So you don't actually need to do anything special there. You don't need any special vaginal washes or vaginal deodorants or antiseptics. And it's actually better not to use those types of products in that area. But what you do need to do is keep the rest of the area, the rest of the vulva and the external genitalia, including all those labia, lits we talked about, nice and clean. And the best way to do that is to wash daily with a gentle, unscented soap.
Yeah, awesome. So good. And what about any of the kind of health problems that can happen down there, down under?
Yeah, there are a few, and the commonest ones that I get asked about are one called thrush and one called urinary tract infections. So these are common, they're really easy to test for and to treat. So if you have any symptoms at all, please talk to your doctor. But I'll just go through a little bit of the normal bacteria in the vagina. So we all have normal, healthy bacteria in the vagina, and they help protect it against potential harmful bacteria.
So good.
It's amazing. So usually this keeps a really nice balance. However, if your good bacteria are wiped out for some reason, for example, being on a really strong course of antibiotics, you might get overgrowth or kind of dominance of one of the bad bacteria or yeast bugs. And that's where we can run into a problem with a thrush infection. That can cause symptoms like pain when you pass urine or itchiness, or you might notice that your vaginal discharge is changed in the thickness or that there's more of it. But like I said, it's really easy to test for and to treat thrush. Another really common thing that happens in women is that they can get a urinary tract infection. And in that case, a bug goes up the urethra into the bladder. And that causes pain when you pass urine. And it can also cause frequency, meaning you're running to the toilet every 5 minutes.
Yep.
But easily treated. So.
Yeah, and what are some good ways to try and avoid? So particularly like UTIs, it's like things like not wearing wet togs, anything that's going to cause that bacteria to be able to move around. Young girls, you might not be aware or might not have been taught as well the importance of wiping from the front to the back, because obviously if you're wiping back to front, when you're wiping yourself down there, then you're actually bringing all of the bacteria from down near your anus up through your vagina and towards the urethra as well.
Yeah, exactly.
Was there anything else or that?
Yeah, another really good tip is to stick to cotton underwear. If you can, avoid tight-fitting synthetic clothing and tights.
Grandma undies.
Yeah, exactly. Drink plenty of water. Get out of your wet swimmers as soon as you can. Keep active with healthy diet and regular exercise. A few other things, like we said before, avoiding any scented soaps or products in that area, which can irritate the skin. The skin's really quite sensitive down there. And then also avoiding constipation or holding on to your wee for too long. And then lastly, when you do start to become sexually active, doing a wee before and after sex will help to flush out any of the bacteria that's sitting there.
Yeah, awesome. So good. Well, thanks so much, Laura, for coming and sharing all of your knowledge with us today. And yeah, as we said before, we hope that you found this video super useful. We'll jump up a link just as soon as this video finishes for you to continue being able to follow us along on Instagram, Facebook, kind of using Facebook, but definitely Instagram, and you can keep following and stay up to date with everything there. So thanks so much, and we can't wait to see you again soon. Bye.
See ya.